Quittor. Quittor is a condition resulting from necrosis of the lateral cartilage and is noticed by the presence of sinus openings in the coronet region. The fore or hind feet may be affected. Etiology 1. Infection getting into the cartilage through an opening in the coronet region, e.g., tread injuries. Necrosis of skin in the pastern region due to constant accumulation of mud. 3. Suppuration extending from neighboring lesions like suppura, ting corn, sand crack, penetrating wounds of the foot, etc. Symptoms. The coronet appears swollen, and one or more sinus openings may be noticed in the region. These sinus openings arise from the necrosed portion of the cartilage. Complications. 1. Septic arthritis of the coronopedal joint due to extension of the lesion. 2. Necrosis of the os pedis. 3. Necrosis of the sensitive laminae or the plantar cushion. 4. Gangrene of the skin of the affected region. Prognosis guarded. Many cases, however, respond favorably to treatment. Quittor in the hind limbs responds to treatment better than of the forelimbs because the lateral cartilages are thinner in the hind limbs. Treatment. On general principles as for sinuses. Surgical treatment consists of removal of lateral cartilage. 1. Irrigation of the sinus tracts with antiseptic lotions to remove pus and necrotic tissue, but this may cause spread of the lesion to surrounding tissues because it is difficult to remove the fluid completely. 2. One of the following solutions may be injected into the sinus tracts to control bacterial infection and facilitate separation of necrotic tissue. Corrosive sublimate in alcohol 1 in 10, zinc chloride solution 5 to 10%, zinc sulfate solution 5 to 10%. 3. A solid caustic like silver nitrate or corrosive sublimate is powdered and introduced through the sinus openings. This is called coring. The caustic facilitates separation of the necrotic tissue by forming an eschar or core. This has got only limited use because, to be effective, the powder should reach all necrotic tissue. 4. Applying a red-hot iron through the sinus openings. The effectiveness of this treatment depends on whether the necrotic tissue comes in contact with the red-hot iron. 5. A combination of treatment with red-hot iron and use of caustics. 6. Aceton passed through the opening in the coronet and through the wall of the hoof in level with the bottom of the suppurating tract, provides good drainage and helps quicker healing. 7. The operation for removal of cartilage, excision of the lateral cartilage, is done under general anesthesia. The horse is cast and secured in lateral recumbency with the affected side of the foot above. A tourniquet is applied above the fetlock. The cartilage is exposed by stripping the corresponding portion of the wall of the hoof. The portion of skin in the pastern region also is reflected along with the stripped piece of horn so as to expose the cartilage completely. The stripping of the horn is done as follows. First, make a groove extending from the coronet to the plantar aspect of the foot, in level with the anterior border of the cartilage. Then make a similar groove in level with the posterior border of the cartilage. Join the lower extremities of these two grooves by a third groove made along the white line on the plantar aspect of the foot. Hold the demarcated piece of horn at its lower border with pincers and lift it upwards. To reflect the corresponding piece of skin in the pastern region, 2 incisions are made continuous with the vertical grooves on the hoof. The exposed cartilage is removed by using a sage knife. All the necrosed tissues are removed and hemorrhage is controlled. The reflected piece of skin is kept in place after cutting away the portion of horn below its coronary border, leaving the coronary band intact. A bandage is applied. The dressing is changed next day and thereafter on alternate days. Healing takes 4 to 6 weeks or more.